I'm Julie Desmarteau. I'm a physician assistant with the Epilepsy Center, and prior to my role here as a physician assistant, I was a registered dietitian, and I helped get the ketogenic diet program restarted here at MUSC. So I work mostly in the outpatient arena, so I see patients in clinic. That's about 50% of my time. The other 50% of my time is following up on all the work that gets generated in clinic, so people's paperwork, answering phone calls, troubleshooting with people by phone. But mostly the physicians will see the patient for their first visit, and then they refer the patient to me for follow-up. So I help them manage their medications, troubleshoot with them in between visits if necessary, talk to them about other options including diet and surgical workup. Ketogenic diet, that is a type of therapy that can be very effective in treating seizures for people who don't respond to medication. I like to think of the ketogenic diet as sort of a way into tricking the brain to thinking that it's starving, only without actually starving. And it's one of the oldest known treatments for seizures. It's been mentioned in the Bible about fasting for seizures and in other ancient texts. And what the ketogenic diet does is it is very low in carbohydrates. So that's your starches, your sugars. If you remove those from the diet, then your brain sees that there's no sugar coming in. And without the sugar, your brain thinks that the body is starving, and it switches over to use a different kind of energy. If it can't run on sugar, it has to run on something else. So it'll switch over to running on something called ketone bodies. Ketone bodies are made from fat. Now when you're starving, you get your ketone bodies by breaking down your own fat tissue. And we don't want that to happen to our patients. It wouldn't be practical to tell our patients that they just have to starve forever. So we make sure that they can make the ketone bodies by feeding them a lot of fat. And we make sure that they get enough protein too. And when you're actually starving, your muscle starts breaking down. You start breaking your muscle into protein, and we don't want that to happen either. So all we're trying to do is remove the carbohydrate, but make sure that you get enough protein and that you get lots of fat to make the ketone bodies for your brain to run on. Something about that process, from switching the brain from sugar to ketone bodies as its energy source, seems to have an anti-seizure effect. And there's a number of reasons why it may work. No one has been able to pinpoint it exactly as to say this is why it works, but we know it does work, and we have a few different theories about the different mechanisms that could be the reason why it is helpful. When would you think about starting a patient on a ketogenic diet? Typically, we try at least 2 seizure medicines first. Why 2? Why is that the magic number? If you look at all people who have epilepsy for any reason, about half of them will become completely controlled on the first medicine they try. Great, awesome, those people sail into the sunset. Another 10 to 20% of people can become completely controlled on the second medication that they try. And great, those people are wonderful, again, sailing off into the sunset. That leaves you with about a third of people with epilepsy who have tried 2 seizure medications and have still not gotten seizure control. The chances of them getting seizure control with any combination of medications, no matter how many they might try or how many combinations they might try, statistically the chances of them getting total seizure freedom with medication alone is less than 3%. So if you know that your chances of getting seizure freedom are less than 3% with medicine, it's natural to start thinking, okay, well, what else could I do? What's going to increase my chances of getting seizure free? And so usually that's going to involve surgical approaches or the diet. And not everybody is a surgical candidate, right? So if you're going to have surgery for epilepsy, that's only for certain types of epilepsy. We have to have a pretty good idea of where the seizure is coming from. It has to be part of the brain that's safe to remove. And there are different stimulators and things that can be used, but those have lower rates of actual seizure freedom. Those are geared more towards improving seizure control. The diet can be more effective, and depending on the study you look at, probably from 5 to 15% of people on the diet can get seizure free if they are following the diet perfectly. Now 5 to 15% may not sound super exciting, but compared to less than 3%, that's a chunk of change right there. Now the people who get really, really good seizure control, maybe not perfect, that's probably another 10 to 20% of people, maybe even slightly more than that. So you're looking at around 30%, maybe more of people with really good seizure control, either perfect or 90% reduction in their seizures. And that's much better than medication at that point. Overall, I would say about 50% of people, maybe slightly more than that, have a significant reduction, like 50% or better reduction in seizure control. So that can certainly be significant. So we start to think about the diet when medications haven't worked. There are also certain syndromes where you know right off the bat that medication alone is not going to get the job done, and we go ahead and we start thinking about diet right away. There are also some conditions where there are medication options, but for whatever reason the family just may not want to pursue them because they're riskier. For example, infantile spasms. There's a couple of medications that can work pretty well for them, but they do have some very serious side effects. So some medical teams and a lot of families are preferring to try the diet first as a first-line treatment for that, rather than the medication first, and either is a valid option. There isn't really a particular combination of medications that is better to use with the diet or worse to use with the diet. AEDs, the key with which medications to use with the diet is just that you have to make sure that the medication doesn't have carbohydrate in it. So that means it can't be in a liquid form. Generally, because almost all of the liquid medications have carbohydrate in it, and remember, you're trying to cut out all your starches and sugars, including what might be additives in the medication. So side effects of the diet, and I think that's really important to understand, is that the diet does have side effects. One thing that kind of grates on my nerves is when people talk about the diet therapy as being natural. They feel like it's more natural than medication, and I disagree with that 100%. You are completely changing the way your entire body metabolizes energy. There is nothing natural about trying to cut out many major food groups. So I don't think that the diet is natural at all, and it can definitely have side effects, many of which are similar to the side effects of seizure medication. So side effects of the diet could include that it can increase your risk of kidney stones. In children, it is associated with decreased growth, and some kids catch up once they're weaned off the diet, but other times it can be associated with decreased growth, the final height that you might reach. Bone density issues are a concern with the diet, as they are with many of the medications. The diet can predispose you towards weaker bones. Constipation is probably, I know it sounds like a minor thing, but for the patient suffering from it, it doesn't feel good, and it is a major, probably the most common side effect of the medication of being on the diet. Fortunately, Miralax is allowed when you're on the diet, so we can work with that side effect. There are some rare but serious complications of the ketogenic diet that have been reported. I've not actually seen it happen, but if you don't take the correct vitamin or mineral supplements, in theory you could end up with something severe like selenium deficiency, and that can cause cardiac problems, cardiomyopathy. There have been cases of pancreatitis reported with the ketogenic diet, but again, those things are not terribly common, and I would not consider them a major deterrent to starting the diet. But it definitely needs to be made clear that the diet can have side effects just like the medication. So by going on the diet, it doesn't mean that you're going to be side effect free or have no issues. Also, the diet is usually used with medication. Occasionally, there are people who respond so well to the diet that they are able to wean off all or at least some of their medication, and that is awesome, but it is definitely not the case with everyone. So typically people on the diet do also take some medications, and the medications and diet work together to help control the seizures, sort of a group effort. Also, even if you are one of the lucky few who responds so well that you don't have to take any medications at all, there are still pills to take because this is not a very healthy diet. So there are lots of vitamin and mineral supplements that you have to take. At the very least, things like multivitamins, but there can also be other supplements that you may need. For example, if you do end up developing kidney stones, we prescribe sodium bicarbonate to be taken twice a day and different things. So going on the diet does not promise you a pill-free existence either, and that's really important for people to understand up front. Non-compliance is a huge issue with the ketogenic diet, and it's definitely probably the #1 reason for diet failure. It's just that it is very difficult to stick with. Now, there are different types of ketogenic diets. There is the extremely regimented, extremely high-fat, very, very low carbohydrate classic ketogenic diet where all the foods need to be weighed out on a gram scale, and that can be very demanding. When the dietitian tells you it's 12 grams of chicken, we want that to be within, 0.3 grams. So, it has to be like 12.2 grams of chicken. We can let you get away with that, but not 12.4 grams of chicken. And that's how demanding and exact it has to be. So that's a lot of work. It's very demanding. And then also it can just be hard for people to change the way they eat that dramatically. There's a less strict version. Sometimes people call it the modified Atkins diet for epilepsy. That isn't quite as regimented. And there's also another version called the low glycemic treatment for epilepsy. And those can be a little bit easier to be implemented, and they're more popular with adolescents and adults. Younger children, sort of the captive audience that they are, they do a little bit better with the extremely strict diet. Also, they don't have years of food preferences built up that adolescents and adults do. It makes us a little more resistant to changing our diet in a radical way, even when we have really good intentions. Also, the diet can be complicated. The highly regimented diet in many ways can be easier because the dietitian will plan it out for you 100% down to the last gram of what you're supposed to eat and when. Other diets like the modified Atkins diet or the low glycemic index diet, that does require a certain degree of intellectual ability. There's a lot of label reading that has to be done, a lot of meal planning, and so if someone is struggling with cognitive issues, that can be difficult to implement. And I've definitely seen that happen where people meet with the dietitian, but they come back to the next visit and they're not reading the labels correctly. They think they're complying with the diet, but they just haven't really grasped how you count your carbohydrates and what they can and can't have. So there's non-compliance for reasons of it just being difficult, and then there's non-compliance because people just generally have a difficult time grasping what it is that they're supposed to do. That's why it's really important to have a dedicated registered dietitian who is specially trained in the ketogenic diet, which most registered dietitians are not. We are lucky here at MUSC. We have a very knowledgeable and highly trained, specialized ketogenic dietitian, Laura Doherty, and she's invaluable. We couldn't do what we do without her. That's a really good question, and I don't think that it is necessarily better suited for one type of seizure than another. That's what's so interesting about it, is that it really does seem to be beneficial across a really wide range of seizure types, of seizure syndromes. People with tuberous sclerosis can benefit from the diet as much as someone with idiopathic genetic epilepsy. So I think it's an option that should be considered early and often for our medically refractory epilepsy patients.